COVID-19 third infection wave has already arrived. President Cyril Ramaphosa confirming that tighter restrictions are on the cards as South Africa enters its third wave of the pandemic. Let's take you to Professor Shabir Madhi. He's the Dean of the Faculty of Health Services at the University of the Witwatersrand. Professor Madhi, good evening to you and thanks for your time. Perhaps your own reflections on the direction that Cabinet has taken when it comes to responding to what seemingly could be a third wave for the country.
So good evening to you. So unfortunately, in the presence of what has really been a failure when it comes to the rollout of the COVID-19 vaccine program, there's very little options that we do have available to us to try to mitigate the consequences of the third wave. What we're facing in South Africa is less than 2% of South Africans have been vaccinated. And consequently, because the third wave is upon us, there aren't much options other than to bring about a real limitation on mass gatherings. In fact, the type of limitations that have been proposed and recommended by the President probably is inadequate. If we're seriously wanting to slow down the rate of transmission of the virus during the course of the next few weeks, we literally should be banning this sort of mass gatherings, because even allowing for 100 people in a poorly ventilated indoor space, it's not only those 100 individuals that are at risk of being infected, it's the hundreds of other people that they are going to come into contact with when they go back home and into the workplaces that are at risk of being infected. But this is the making of our own doing, simply because we have failed when it comes to rolling out the COVID-19 vaccine.
Professor Madhi, I just want to get your thoughts on this narrative that seems to always be playing itself up when it comes to what is driving the infections. The criticism is always leveled at South Africans. So you are not doing enough social distancing. You are being complacent. You are simply not doing what you need to do to help us fight COVID-19. Is that a fair assessment of what is really driving infections in the country and the pattern of infections in this country?
So that is a fair assessment of what is driving infections in the country, but that is a consequence of us not having rolled out the COVID-19 vaccine program months ago. Had we started vaccinating 3 months ago rather than 3 weeks ago, we would be in a situation where high-risk individuals would have already had meaningful protection against severe disease, which is what we want. So yes, the behavior of citizens, unfortunately, and particularly engaging in mass gatherings, lends itself to a heightened rate of transmission of the virus. But this is a consequence of a failure in terms of rolling out COVID-19 vaccines. So the answer is, it goes both ways, that it's a failure of the vaccination program, and at the same time, unfortunately, is the behavior of citizens that's contributing to a rapid spread of the virus again.
One of the challenges that the president faces in terms of the credibility around the messaging when it comes to the fight against COVID-19 is that just in the last couple of weeks, we have seen individuals gathered outside a court in Pietermaritzburg under the umbrella of the ANC in that province, who weren't wearing masks, who weren't social distancing, and nothing was done to those individuals. It becomes difficult then to see a situation where law enforcement officers can now enforce these restriction measures in other parts of the country when they so blatantly let some part of the country get away with it.
Absolutely, and certainly that has contributed to what we're facing again. But again, I need to make mention that we also need to understand which type of behavior poses the greatest risk of spread of the virus, and that is indoor mass gatherings, particularly in poorly ventilated spaces. So yes, mass gatherings outdoors also poses a risk, but that is much less than mass gatherings indoors. And I'm talking of our places of worship, I'm talking of the restaurants, I'm talking of the shopping malls. Those are the type of places that usually lends itself to much quicker transmission of the virus than outdoor gatherings.
So effectively what you're saying is, should we continue to see outdoor gatherings, big outdoor gatherings, as we have in the last couple of weeks, that won't be as big a risk, despite what the numbers there are, than what we have in your malls, in your restaurants, etc.?
No, certainly not. I'm not advocating that we allow for massive, large outdoor gatherings either. But that is probably going to be responsible for fewer infections relative to allowing for indoor gatherings, including allowing 100 people at funerals or to attend a church. Those sort of activities, unfortunately, like I said, it's not just those 100 individuals that are at risk of being infected, it's many other hundreds of individuals they will come into contact with. And that is pretty much what we're seeing in some communities, where there were these sort of family gatherings over the past 2 to 3 weeks. And those communities in the Gauteng area are heavily being affected right now. And that's the consequence, unfortunately, of this indoor sort of mass gatherings.
Let's take a look at the provinces right now that are raising the greatest concern. So we have the Northern Cape, the Free State, the Northwest, and Gauteng. Barring Gauteng, a lot of these other provinces have quite a high number of rural constituencies. Does it worry you, the fact that the vaccine at this point, any kind of vaccine, is going to take much longer to reach those areas?
Most certainly so. So we completed a serious survey where we tested for evidence of past infection at the sub-districts in Gauteng, and there are 26 different sub-districts. And around about the middle of January, that percentage at a sub-district level range anything between 5.5% to 20% to 43%. And the areas that were less affected the first time around are those areas that are more sparsely populated, which, as you mentioned, are the peri-urban and rural type of areas. Unfortunately, those are the areas that probably face greater risk of being more heavily affected this time around because they haven't developed the same sort of immunity as other communities that were more affected during the course of the first and second wave. So we need to ensure that the limited supply of vaccine that we do have available, we become even more targeted as to where we roll it out quickly. And it needs to be rolled out quickly in those settings that have had lower forces of infection during the course of the first and second wave. And we've got the data, and that's the type of data which the provincial government in Gauteng needs to be using to determine who to prioritize for the limited quantity of vaccine that we unfortunately have available to us.
The last time that the president addressed us, which was 2 months ago, he spoke about the fact that other vaccines were currently under consideration, some including the Russia's Sputnik and, of course, the Sinopharm variations coming out of China. Today, we're told that those processes are still underway. Do you think that there's been any sense of urgency around that?
Now, firstly, I find it absolutely stunning that government still wants to pursue the Sinopharm vaccine and the Sputnik 5 vaccine for which there's absolutely no evidence, absolutely none, that those vaccines would work any better than AstraZeneca vaccine against the B.1.351 variant. So I really find it stunning that government pursues two vaccines which we don't know whether it will work, while on the other hand, decides not to use a vaccine and not to pursue a vaccine which we know actually works, and that is the Novavax vaccine. So I would really like to call into question what drives government to try to actually procure these two vaccines for which there's very little data as to how it would work against the B.1.351 variant, and in fact very limited data in terms of how those vaccines work even against the ancestral virus. And quite frankly, I do think that requires further investigation as to what is the motive for government wanting to use these two vaccines for which there isn't evidence that it would assist us in South Africa as with other vaccines which government is not wanting to pursue.
Professor Shabir Madhi, the Dean of the Faculty of Health Sciences at the University of the Witwatersrand. Let me leave it there with you, Prof, for tonight. Thank you so much for coming on to News at Prime and weighing in then just in terms of the President's latest address and the move to lockdown level 2 restrictions.